We're really digging into cerebral palsy.
Yeah, it's a big topic.
It is, and we've pulled together a whole range of sources, personal stories, medical guides, research papers. The idea is to really filter out the key insights for you.
Right, to give a clear, structured overview. Because let's face it, trying to understand CP can feel, well, pretty overwhelming.
Definitely. There's just so much information out there.
So think of this as cutting through that. We want to give you the most important stuff quickly and clearly. Make it manageable.
Exactly. And the sources are really diverse. We've got hashtag own voices narratives, which are just so important for perspective.
Absolutely crucial, hearing directly from people with CP.
We've also got medical insights,
Yeah.
like from Medridge, talking about early intervention and brain plasticity,
Yeah.
that adaptability of the young brain.
Super important. And we even look back at some historical stuff like Freud's early work classifying it.
Yeah, it was surprising. And then there are personal journeys, like Sam becoming an engineer, characters like Super Ernie in kids' books,
Yeah, and practical guides too, like from Pasco and Caregiving, NCBI on causes.
and that huge guide, Cerebral Palsy, a complete guide for caregiving. Plus, resources from United Cerebral Palsy Mayo Clinic, Wikipedia for basics.
Nichols Children's Hospital stories, research on spasticity, info on nonverbal CP from Flint Rehab, the Cerebral Palsy Toolkit for families. Lots.
A real wealth of information. So we're going to organize this. We'll look at what CP actually is, what causes it, why starting early matters so much.
Associated conditions, motor skills, what life looks like at different stages, and crucially, the support systems available.
Okay, let's dive in. First off, defining cerebral palsy. What exactly are we talking about?
Well, fundamentally, cerebral palsy or CP isn't just one thing. It's actually a group of permanent disorders
Okay, a group affecting.
affecting movement and posture, and the cause is some kind of non-progressive disturbance in the developing brain.
Non-progressive.
Yeah.
It's a key term, isn't it?
It really is. It means the original brain injury doesn't get worse over time.
But the symptoms, how it looks, that can change as someone grows.
Exactly. The manifestations can evolve, leading to limitations in activities and sometimes restricting participation in life. Oh, and it's definitely not contagious.
Right. Important point.
Yeah.
And you mentioned Freud earlier. How did he fit into the early understanding?
Yeah, it's interesting. Before his fame in psychology, he was a neurologist. He actually worked on classifying these conditions based on when the brain insult happened, prenatal, natal, postnatal.
Before, during, or after birth?
Precisely. And he made connections between where the brain damage was and which limbs were affected, and noted different movement disorders. It just shows how understanding builds over time.
Fascinating piece of history. So what are the underlying causes? What leads to this brain damage or abnormal development?
The core issue is damage or abnormal development in the brain while it's still forming. And research suggests, well, over 3/4 of the time, this happens during pregnancy.
During pregnancy, okay.
And structural problems in the brain are really common, seen in about 80% of cases. Often it involves the white matter.
The brain's communication pathways.
Exactly. There's a condition called periventricular leukomalacia, PVL, where the white matter, especially around the fluid-filled ventricles, is damaged. That's quite common.
Are there other specific causes mentioned? What about after birth?
Yes, head injuries can sometimes cause post-neonatal CP, meaning it develops after the first couple of years. One study put that around 12% for that specific type.
Okay.
And then there's neonatal encephalopathy. That's just a general term for brain dysfunction in newborns, and hypoxic ischemic encephalopathy, which is brain injury, due to lack of oxygen and blood flow.
HIE, right.
Yeah. Those were significant factors in some studies, particularly, it seems, in children with quadriplegia affecting all 4 limbs.
It makes total sense why parents would desperately want to know why. Why did this happen?
Oh, absolutely. It's a natural question, part of processing everything. And kids themselves often want to understand why they face certain challenges.
Which brings us to something really highlighted in the sources. Early intervention. Why is getting started with therapy so early so vital?
It comes down to that brain plasticity we mentioned. The brain, especially from birth to around age 2, is incredibly adaptable.
It can rewire itself, essentially.
Sort of, yeah. It can reorganize and form new neural connections based on experiences. For a child with a brain injury like in CP, this plasticity is a huge window of opportunity.
So early therapies are basically trying to capitalize on that window.
Exactly. The evidence is strong. Starting therapies, physical, occupational, speech, as soon as CP risk is identified in that 0 to 2 age range can make a really significant difference to motor skills, cognitive function, even social development.
It's about maximizing that potential during peak adaptability.
Precisely. Helping the brain build the best possible pathways for the future.
Okay, now CP rarely exists in isolation, does it? The sources talk a lot about associated medical conditions.
That's a really important point. Yes, kids with CP often face other medical challenges. It's quite a range.
Like what kinds of things?
Well, seizures or epilepsy are quite common. Developmental delays, too, which if they persist past age 4 or so, might be classified as an intellectual disability.
Learning disabilities, ADHD.
Yes, learning disabilities and ADHD are also more common. And sometimes hydrocephalus, which is that fluid buildup in the brain.
Vision problems seem common too.
Definitely. Things like strabismus, where the eyes don't align, crossed eyes, or amblyopia, lazy eye. Hearing impairment can also occur, sometimes linked to frequent ear infections.
And what about things like eating?
Feeding and swallowing difficulties are very common, especially in children with more severe motor impairments. This can lead to risks like aspiration food or liquid going into the lungs, and also gastroesophageal reflux.
Which increases the risk of pneumonia.
It does. Other potential issues include low bone density, making fractures more likely.
Especially leg fractures in kids who aren't walking much.
Yes, unlike typically developing kids who usually fracture arms. Also, dental problems and neurogenic bladder, which affects bladder control.
It's quite a list. You mentioned severity. Is there a way to classify that? Something called the GMFCS.
Yes. The Gross Motor Function Classification System. It's a 5-level scale clinicians use to describe a child's gross motor function, basically, how they move around. Level Fiji means they walk without limitations, while Level V describes children transported in a wheelchair with limited voluntary movement control.
And you said feeding issues are linked to higher levels.
Generally, yes. Kids with more significant motor limitations, so levels high V or V, for example, often have more challenges with feeding and swallowing. It highlights how interconnected everything can be.
It really does. Let's talk more about the motor skills themselves. How is CP classified based on the type of movement issue?
Okay, so the main types you hear about are based on how movement is affected. Spasticity is the most common, that's increased muscle tone, stiffness.
Right.
Then there's athetosis, or dyskinetic CP, which involves involuntary, uncontrolled, often twisting or writhing movements.
Okay.
Hemiplegia means one side of the body is affected, one arm and one leg.
Hemi, like half.
Exactly. Diplegia primarily affects both legs, often with milder arm involvement. Quadriplegia affects all 4 limbs, plus the trunk and often the neck.
Quad meaning 4.
Right. And finally, ataxia involves problems with balance and coordination, leading to unsteady, shaky movements.
So those classifications describe the type of motor issue. How does this impact typical childhood development, like hitting milestones?
Well, those early motor milestones, rolling over, sitting up, reaching, crawling, walking, they can definitely be delayed in children with CP.
And development usually goes head to toe, right? Control the head, then the trunk, then limbs.
That's the typical cephalocaudal progression, yes. Head control, then trunk stability, then limb use for crawling or walking.
But the guides also caution that developmental charts aren't absolute deadlines.
Very true. Every child develops at their own pace. But if there are significant delays or maybe unusual movement patterns, especially alongside other risk factors, that's when you definitely want to talk to a doctor. Balance and coordination issues, particularly in ataxia, are often major factors impacting walking.
Let's trace this across the lifespan. Early childhood, birth to 3. What might parents notice?
In that first year, it might just be a nagging feeling that something isn't quite right. Maybe the baby isn't rolling by 4 months, or isn't babbling or wary of strangers by 6 months, or isn't pulling to stand or starting to walk by around a year. Those typical markers might be missed or delayed.
And moving into the toddler phase, 1 to 3.
This is usually a time of huge leaps in independence, walking, exploring, starting to talk more. For a child with CP, these steps might be slower or look different. Toilet training can also be a challenge. Voluntary control usually develops around 18 months, but physical limits can interfere.
Are there tools to help with that?
Oh yes, adaptive potty seats and systems can make a big difference. And therapists like OTs or PTs can offer great strategies.
Okay, moving into school age, say 4 to 12, what changes then?
Interestingly, for some kids, especially those with diplegia, this can actually be a period of significant physical improvement in their walking. Yeah. But once they start school, the focus often shifts more towards cognitive things. Subtle learning difficulties might become apparent, or maybe more defined learning disabilities, even if the child has typical intelligence overall.
So monitoring school progress is key.
Absolutely. I'm trying to figure out, is this anxiety about being different, or is it an actual learning disability that needs assessment and support? Psychological testing can help clarify that.
The social side must become more complex too.
Definitely. Kids become more aware of differences. They might feel left out or get teased, and sometimes withdraw socially. It's so important to have open conversations, provide lots of praise and support to build their self-esteem during this time.
And you mentioned walking improvements leveling off.
Yeah, often around ages 8 to 10, particularly for those with diplegia, the major gains in walking ability tend to plateau.
Okay, then comes adolescence. That's a period of big changes for everyone. How does it impact someone with CP?
Growth spurts can actually make things harder, especially walking. Increased muscle tone or spasticity can worsen as bones grow quickly.
That seems counterintuitive.
It does, but the muscles struggle to keep up with bone growth sometimes. It's also a critical time to monitor the spine for scoliosis, that sideways curve, or kyphosis, the forward hunching.
Embracing help with that?
Sometimes it's tried, but it's not always effective in preventing progression in CP. If the curve gets severe, surgery might be considered.
What about feet?
Yeah, issues like flat feet or persistent toe walking can become more pronounced. AFOs, those ankle foot orthoses or braces, are often used here to help support the foot and ankle. Drooling can also sometimes persist or worsen, and there are strategies to manage that.
And hip problems. I remember reading that's a big concern, especially with more severe CP.
A huge concern. Hip subluxation, where the ball of the hip joint is partially out of the socket, or full dislocation, it's much more common in quadriplegia. Early detection through exams and x-rays is absolutely vital.
Can anything be done to prevent it?
Sometimes releasing tight hip muscles surgically can help, but careful monitoring is key. Also, in adolescents who don't walk, osteoporosis weak bones becomes a risk because they aren't getting that weight-bearing activity.
And hands and wrists.
Contractures or tightening can develop there too, limiting function. Again, surgery might be an option in some cases. Overall, adolescence is a time for accepting the current level of function, preparing for puberty's changes, and for those with severe involvement.
Planning for the future becomes really important.
Hugely important. They'll likely need ongoing help with daily living, communication, planning for support, maybe trained aides, finding ways to maximize independence. That becomes a major focus.
And what about adulthood? What does the long-term picture look like?
Adults with CT absolutely can and do live long, full lives. But certain things can impact their prognosis or long-term health.
Such as?
Persistent issues like those eating, swallowing difficulties, sensory problems, any intellectual disability, mobility limits, musculoskeletal issues like arthritis or pain, breathing problems, seizures, these can all play a role.
Are there challenges specific to adulthood, like work or living situations?
Yes, definitely. Finding employment, dealing with potential discrimination, navigating insurance, these can be hurdles, although laws like the Americans with Disabilities Act, the ADA, have made a positive difference.
Right.
Planning for long-term care and where to live is also crucial. Group homes can be a great option for some, offering support while fostering independence.
And ongoing medical care.
Still vital. Having a primary care doctor who understands the needs of adults with disabilities is really important and may be overlooked sometimes, but adults with CP have the same needs for intimacy, relationships, and sexual expression as anyone else. That needs to be acknowledged and supported.
Let's touch on communication and sensory issues specifically. We mentioned nonverbal CP.
Yeah, it's so important to remember speech and language are different. Someone might not be able to speak easily or at all, but their understanding, their receptive language could be perfectly fine.
So they understand everything, they just can't physically produce speech.
Exactly, in many cases. That's where AAC comes in, augmentative and alternative communication.
Like communication boards or devices.
Right. It ranges from low-tech picture boards to very sophisticated eye gaze systems or speech-generating devices. It's about finding the right tool for that individual.
And sensory issues. You mentioned hypersensitivity or hyposensitivity.
Yes. Sensory processing differences are common. Some individuals might be overly sensitive to touch, sound, or light, while others might be under-responsive, maybe not noticing pain or temperature extremes easily.
And that can affect development, too.
It really can. If a child avoids certain textures because they feel unpleasant, it might limit their exploration and learning through touch, which impacts motor skill development. Understanding and addressing these sensory needs is important.
Okay, let's shift to management and therapies. We've stressed early intervention. What does that typically involve?
It's usually a team approach. Physical therapy, or PT, is key for gross motor skills, strength, balance, gait training, if applicable.
Mm.
Occupational therapy, OT, focuses more on fine motor skills using hands, coordination for daily tasks like dressing, feeding, writing, and also sensory integration.
And speech therapy.
Speech language pathologists, or SLPs, work on communication, of course, including AAC, but also, very importantly, on feeding and swallowing issues.
We also talked about devices like splints, casts, and AFOs.
Yes, these orthoses are crucial tools. They help manage spasticity, prevent deformities like contractures, support joints, and improve function like standing or walking. Serial casting is sometimes used to gradually stretch tight muscles. AFOs are very common for foot and ankle control.
Are there surgical options too?
Yes, for specific issues. Things like selective dorsal rhizotomy to reduce leg spasticity, or installing a backlofen pump for medication delivery. Surgery might also be needed for hip dislocations, scoliosis correction, or releasing tight tendons, contractures. Finding surgeons experienced with CP is important.
And assistive devices for mobility.
Absolutely. Walkers, crutches, wheelchairs, they are essential for independence and participation for many. Proper fitting and safety are paramount. Oh, and don't forget dental care. It's really important due to potential feeding issues or difficulty with brushing.
It sounds like navigating all the support systems is a huge part of managing CP.
It really is. First, the healthcare system itself. You might interact with pediatricians, maybe med-peds docs who treat kids and adults, neurologists, orthopedists, eye doctors, ear, nose, throat specialists, dentists, mental health professionals.
The whole team.
Often, yes. And building a good collaborative relationship with those doctors is key for parents.
Then there are the financial aspects.
Right. Dealing with private insurance, understanding deductibles, co-insurance, coverage limits, especially for ongoing therapies or equipment, can be complex. And then there are government programs like Medicaid for healthcare coverage and SSI, Supplemental Security Income, for financial support.
And planning is needed to maintain eligibility for those.
Yes. Things like special needs trust become important so that receiving inheritance or savings doesn't disqualify someone from essential benefits.
What about the education system?
That's another big one. In the U.S., the Individuals with Disabilities Education Act, IDEA, guarantees a free, appropriate public education, or FAPE.
Through an IEP.
Exactly. The Individualized Education Program. Parents are crucial members of the IEP team, deciding on goals, supports, services, and placement, whether that's a regular classroom with support, a special education classroom, or even a specialized school.
And before school age.
There are child find programs designed to identify developmental delays early. This often leads to an IFSP, an individualized family service plan for early intervention services from birth to 3.
And legal aspects.
No.
Advocacy.
Also vital. Advocates can help families understand and assert their rights within the healthcare and education systems. Sometimes legal guardianship might be necessary when an individual turns 18 if they can't make decisions independently. And the ADA provides critical protection against discrimination in employment, public services, and accommodations. Estate planning is also something families need to consider carefully.
You mentioned respite care earlier, giving caregivers a break.
So important. Just providing temporary relief for parents or primary caregivers, it's essential for preventing burnout and maintaining family well-being.
And finally, support organizations.
There are many fantastic ones out there. United Cerebral Palsy, UCP, is a major one, but also the Ability Toolbox, PASCO, CPNOW, TechReam Home and Community Care, National Rehabilitation Association, Scopy, the list goes on. They offer resources, information, community connections, advocacy.
Wow. Okay, we've covered a huge amount of ground here. If we were to boil it down, what are the absolute key takeaways from this deep dive?
I'd say first, CP is complex. It affects movement and posture due to an early and non-progressive brain issue, but it looks different for everyone. Second, early intervention is absolutely critical. Leveraging that brain plasticity makes a real difference.
Right.
Third, be aware of the potential associated medical conditions. It requires a holistic view of the person's health. Fourth, needs change across the lifespan, from infancy through adulthood, requiring different supports.
And
Finally, those support systems, healthcare, financial, educational, legal, emotional, community service, They are absolutely essential. They empower individuals with CP and their families to navigate the challenges and thrive.
It really drives home that while CP presents undeniable challenges, people can absolutely lead rich, meaningful lives, especially with the right support and understanding, which seems to be growing, thanks in part to those hashtag